Dr. Neil, how are you? It's great to have you with us. How's things going?
It's pretty busy. Thanks for having me on.
Well, just
Ah,
so let's do a quick tour. That's Mandy, you see, who's not feeling well, but hopefully you won't see her in your
hi.
emergencies.
Nope.
Hi, Mandy. Sorry you're not
Hi.
feeling well.
Oh, thank you for everything you're doing. You're amazing.
We have Russ Broom on the guitar. So if you need any accompaniment for anything, we got somebody for you.
Yeah.
Thank you, Russ.
Thanks for doing what you do.
Ah, so and I'm Dave, and you know Jim rather well for a long time, from what we understand.
Yes, Jim and I have known each other for about 15 years, maybe more. Jim, right?
Ever since kindergarten,
That's right.
our kids' kindergarten.
Now, we know you are a busy guy, so first of all, we want to thank you, but especially tell us how are things going in the world of emergency right now, and then maybe go into what is your role going forward with COVID?
Well, interestingly, things have quietened down in the emergency department probably for the last week and a half, ever since the first Calgary case, Dave. So I think the public are justifiably wanting to avoid emergency departments. I think it's out of a bit of altruism to give us some space to deal with the pandemic, but also because of concern about becoming infected, which I can understand. So our volumes are down maybe about 20% right now. They were down more, but things are starting to pick up now. But we are seeing a lot of infectious disease cases in the emergency department. They comprise maybe half of our presentations right now, which is much more than usual. We're starting to see some sicker patients with COVID right now as the pandemic evolves and people start to get a little bit sicker with their illness. So my role as kind of pandemic lead physician for the emergency department is to prepare the emergency department for what we think is probably going to be about double the number of patients that we normally see. And
Wow.
then, yeah, that's significant. And then also preparing our interactions with the other services. So this illness, as you know, is serious because around 5 to 10 to 15% of people will develop a very severe respiratory illness, and they'll require some intensive care from other services. So we're trying to make sure we have all the specialists and in terms of people and equipment and space available for that eventuality.
And what timing wise, are you seeing that that'll happen by Tuesday or in a month?
I think, the natural history of the disease, if you're infected on day 0, if you're going to be hospitalized, it's around day 7 to 9 to 10, something like that. If you develop a severe respiratory response, it's around that day 9, 10, 11. If you need critical care, if you're one of the unlucky people who gets a severe response to this, you're going to need to go into the intensive care unit. That's around day 12, something like that.
Yes.
So we're getting into the presentations of the sicker people now, so it's starting to ramp up. I think in the next week we're going to start to see much higher emerge volumes and the need for more transition to critical care.
You mentioned
Wow.
earlier how people can be altruistically staying away or frightenedly staying away. But what's your advice for parents or for anybody to say, look, you still need to use emergency. This is when you should, and this is when you shouldn't.
Yeah, just an interesting point about kids. This is a mild illness in kids, Dave. It doesn't usually affect kids. In fact, kids may have had it and you wouldn't even know it. They could be asymptomatic or have very mild symptoms, just like the regular common cold. So, I think one important message I would have for the listeners is not to come to the emergency department for testing. So if you're solely concerned that you might have this illness,
Yeah.
then please phone 811 and they will set up testing if it's appropriate. So don't come to the emergency department for that reason. It's tough for us to deal with infectious cases. We've had to reorganize our emergency department so that when the infectious people come in, they're separated from the non-infectious people.
Right.
We just can't handle the capacity of people coming in asking for testing. If you think you're sick from the illness, then we can see you. If you think you're significantly sick. So if you have mild illness, we're probably just going to send you back home with advice to take Tylenol, lots of fluids, and rest. But if you have chest pain, and more importantly, shortness of breath. That's one of the real important symptoms. If you have shortness of breath that persists, then probably you need to be seen in an emergency department. And if I can just add one other thing, all the usual problems that you would come to an emergency department for, if you think you have a broken bone, if you're concerned about chest pain, that it might be a heart attack, a stroke, complications of diabetes, open for business, we still need to see you for those problems. Please don't stay at home inappropriately and come in later with a more complex presentation. So we can handle the regular load. It's just the people who come in because they're worried they might have it for testing. We'd rather you just phone 811 and avoid the emergency department altogether.
Great.
Jim or Mandy or Russ, any thoughts or questions?
Well, I'm wondering how many people was it a mad rush of people coming in, Neil, for a while there, or?
Well, I'll tell you, what saved us was the extremely competently set up testing centers. So there were some folks from Alberta Health Services on very short notice that set up these testing centers. On day one, they're testing hundreds of people. So if you can imagine trying to get a facility, trying to get nurses to staff it, set up the processes, they did it in a 24-hour period, and they completely offloaded the emergency department. So by day 2 or 3, they were seeing 1,000 patients a day that would have completely overwhelmed Calgary emergency departments. Wow. So those people just saved us. So the rush that we thought we were going to see didn't materialize, thankfully. But in health jurisdictions like New York that were behind, I don't want to pick on New York, but many health jurisdictions in the United States were behind on testing, and their patients were showing up in the emergency department for testing, and it overwhelmed the emergency departments immediately.
Wow.
And I know you're not, you're running the emergency department, but just for everyone watching and for us, what are our reminders as far as how important is this social isolation and all those things that people are talking about?
Well, a number of people have emailed me and said, isn't this like the common flu, and why don't we just let it run its course? I think the important part is that a significant number of patients who get this virus are going to need critical care. And the critical care is sometimes a ventilator. It's an ICU bed. And your best chance of surviving this, if you get a severe response, if you're unlucky enough to get a severe response, is to have an ICU bed. And then we have every hope that we can get you through this illness. But if the rate of infection in the general population hits a very high number, so if everyone gets affected all at once, then we just can't handle the influx of patients, and then we're going to have to make decisions about who gets the space. Now, we don't want that to happen in this jurisdiction. It did happen in Italy. It did happen in China. It's happening in Spain. It could happen in the United States. We don't want that to happen here in Alberta, and so and I don't think it will. I think the public health folks have been extremely effective in getting the message out. And so what we want to do is stop that rapid logarithmic rise in cases from happening so that we're not hit with a bunch of people who require ventilators and acute care. So we can manage what we think are the projected number of patients that are going to come in here because of the self-isolation. So it is important, and I would like to just reinforce what the public health folks are saying, that that we should engage in social distancing, stay home, no large groups, and certainly if you're symptomatic, you need to be in your house and isolating yourself from other people.
Good for you, Mandy.
Yay.
So
Thanks, Neil.
Mandy is isolating right now, but Mandy also did a piece of art for you. So talk a bit about that. Look at that. Tell us about that, Mandy. Look at that.
So Neil, last week I decided to start highlighting heroes in our community, and I started with Dr. Hinshaw because she's been such a calm rock star, and keeping us all kind of informed but not chaotic, which I think is amazing. So that kind of went around the world, and now every day we're celebrating someone exceptional that is really just our new heroes and paving the way for all of us. So thank you so much for everything you're doing. You're such a special one.
Well, that's really great, Mandy. Thank you very much. And You know, I that came off an AHS picture, and a bunch of people phoned in and said, you know, I think your biceps were photoshopped because there's no way they're that big. And I just want to say that no, they're that big. There was no Photoshop.
The truth comes
They
out
are.
finally.
I know. You know how he kept a straight face saying that. I have no idea.
That was amazing.
Hey Russ, I want to hear some Neil Young on the way out here. When you guys are done with me, I want to hear some Neil Young.
Okay.
Yeah, I can do that. Sure.
All right.
Nice.
So Jim, why don't you do a long, lingering goodbye while Russ plays for
Okay,
that?
and then Neil, you can hang up whenever you're done.